Prioritization comes in different ways on the NCLEX. So they can give you sets of conditions for you to prioritize. Which one will you attend first? Or they can give you a scenario and some set of actions. Which one will you perform first? Or disaster management, which one will you take care of first? It can be in any kind of way. Okay. So prioritization is something that you should be much attentive of before going to the NCLEX. And at times, I think most of us, those of us who started, I think about a month or even just a few weeks ago, if only you've done any of our questions before, sometimes you can realize that you'll get a question where all the 4 options provided are correct, but you are supposed to choose only one answer. So that is also a form of prioritization. So this is to tell you that in NCLEX, anything that you do, you have to prioritize. Okay. So we might not cover 100%, but at least up to about 98, 99%, we will look at some and we will practice a lot to see how best we attack prioritization questions. And it's our prayer that at the end of this lesson, it adds up to all that we already knew, okay, on prioritization. Someone is not muted. Ramatu, please mute up for us. Okay, so let's begin. NCLEX priority questions are designed to assess your ability to prioritize patient care. These questions require you to think critically and quickly about which patient's needs should be addressed first. So here are some tips for answering NCLEX prioritization or priority questions. So we'll look at them in different forms, okay? The first aspect is to assess the situation. So whenever a question is put before you, if possible, try to visualize it in reality. Okay, assess the situation, be in the shoes of what is happening. So before prioritizing patient care, you need to assess the situation, read the question carefully, and consider all the information provided. So with this one, what I normally tell people who are just about to write this NCLEX exam is that you have 5 hours to go through all your questions, whether you finish at 85 or 150 or in between. You have 5 hours, and 5 hours is enough for you to do your 150 questions maximum. There is no need for you to rush. This thing I'm about to say is not too far from us. I think we have 2 of our students, I think somewhere early this year and later last year, at different times. We had someone who was like, that was the first time I even heard of it. That was the first time I heard of similar situation. Like the person was like, when I got to 135 or so, the time was elapsed. So she couldn't even go through all. So hers didn't cut because the computer stopped. It was because the time elapsed. But she was very sure. She is a female, okay. She was very sure that she took her time very well. And like I'm saying, that's the first time I ever heard of that. And God being so good, she passed. Okay, she passed the exam, even though time elapsed, but she was able to pass. So what does this tell you? Rushing through the whole 150 questions and failing, that's not worth it. The NCLEX is something that you have to take your time when you are answering questions. And we advise that you start with the test we give you, the test you do when you are alone, because practice makes a man perfect. as you practice or you solve every question like you are doing your English from now, when you get there, the questions becomes like, and you see, most people give us feedback that our questions are difficult than what they always meet. Most people. All right. And I've never seen anyone who has failed the exam and has admitted, anyone who has failed the exam and has admitted that the questions were difficult and above him or her. I've never seen anyone, though the person failed, but the person did not admit that the questions were difficult. So that tells you that the English is not difficult, but very tricky. Okay, and you can't do something like a shabby work and a shallow work and go and write. Every possible answer among all the options provided in the question are well calculated for. So when they give you 4 options to a question, note that they calculated very well, even for the wrong answers attached to the right answer, so that the right answer will not show up, openly like that for everyone to see. So have this in mind and work harder. It's more of content and 1 or 2 skills that you develop as you practice more. Okay, so it is better to look at the questions word for word, like I was saying. That's what I normally tell people. We'll make sure after reading the question, pick it word for word, because even just an article, just an article or a word can change an answer with the same possible options. Shouldn't leave some at home. Okay. So let us try and practice now. Take all tests seriously right from today. Okay. All right. So assess the situation and open your eyes. If you are here and you've been with us for more than a month and you've been missing out some things in question because maybe you did not read well, then you have to take your time and work on how you answer questions, because that is something that is prompting you. Okay. So there are sometimes there are cases where you might know an answer to a question, but because maybe you didn't answer, you didn't look at the question well, or you didn't understand something small because maybe you didn't take your time, then it will cost you. So if you are like that, it is telling you something right from now, because if you don't pay attention to it and you take it along with you, at the end of the day, you will repeat the same thing on your English and it's going to cost you. All right, so assess the situation before prioritizing patient care. Okay. All right. Let's look at the next one. We are saying you can use ABC where applicable. Okay, the use of ABC. This thing is not anything new to us. ABC, that is airway, breathing, and circulation. This works in general prioritization questions, but in cardiopulmonary resuscitation, you use CAB instead of ABC. Okay. Cardiopulmonary resuscitation. Let me give you an example. Like you have a patient who has arrested. You have a patient who has arrested, and they give you possible options that which one will you do first? Okay, which of the following actions will you perform first? And you have start or initiate chest compressions. You have open airway. Okay, or you have another option like give the patient oxygen, a high flow, 100% oxygen, something like that. You know that though we have our ABC there, but you not go for airway as your first option in this scenario that I just cited. You go for start or initiate chest compressions as your first option. So that is what I mean by it is CAD in cardiopulmonary resuscitation. But aside that aspect, in general prioritization, consider ABC. Okay. All right. Then we are saying these are the top priorities in any patient situation. So always address these needs first. So that is one thing about the ABC too. So we look at them in points, bit by bit. Then, like I said earlier, we'll do lots of practice and see how we can apply them. The next one here is identify the most urgent needs. Identify the most urgent needs. So you have to look for cues in the question that indicates a patient is in distress or immediate danger. This is very important. I don't know how you are understanding it right now, but it is telling us a lot of things. Maybe I'll see whether I can demonstrate it in different way. We are saying this may include vital signs change or changes in vital signs, abnormal laboratory values, or symptoms such as severe pain or shortness of breath. So with this one, what you can also deduce from here is that it is sometimes, please mute up. Yeah, that's true. Okay. So identify the most urgent needs. Like I was saying, let me try and see whether I can give an example here. You can be given a questionnaire where especially situations where they give you 4 conditions for you to prioritize. Which one will you take care of first? Sometimes they will give you one particular example that appears or that seems to be like the patient is even dying or the patient is very, very, very critically ill. Then they can give you another condition where a patient is, the general condition of the patient is not actually alarming. But currently, what that patient is feeling will be something that should be given an eye or a concern. Okay. So no matter how big the symptom looks like, look out for the long and the short of the whole thing is look out for something that is imminently happening. Okay. Let me see whether I can even deduce it more. When they tell you that a patient has maybe pulmonary edema. Okay, patient has pulmonary edema. Even just like that, I'll not even continue. There is another situation where they can tell the patient is having pulmonary edema and is taking maybe a loop diuretic, okay, or any form of diuretic. That is also there, but let me land on only pulmonary edema. When a question, or let's say prioritizing questions, when you get an option like that, though the patient has pulmonary edema, but the question has not informed you or has not explained that this patient is going through an immediate danger, that should be given a concern. Okay, that should be given a concern. So comparing this option to someone who is having let's say a pain, okay, a pain in let's say the right foot, okay, and feeling numbness in the foot. You see, in this case, comparing the pulmonary edema and the pain in the leg, of which is accompanied by numbness, you have to select the numbness first over the pulmonary edema. Okay, pulmonary edema is a whole condition itself, but you see, that pain and feeling of numbness is something imminent that is really happening right now, and that should be taken care of. If, like, let's say they have added to the pulmonary edema that the patient is having maybe like distress, an imminent distress, that one could be prioritized over just the pain. And even with that, there are exceptions. You see, sometimes we'll look at examples, but I'm trying to cite some few ones to you so that you will understand what we are discussing better. Even sometimes they might tell you that patient is having pulmonary edema and is having difficulty breathing, okay, and has dyspnea, something like that. You know that anyone with pulmonary edema definitely will have what? A dyspnea. So that is also an expected sign. I think it's part of the point. We'll come to that side. Okay. But someone, let's say someone who just took an injection. Let's say the person took an IM injection at the right gluteus maximus. Okay. Then for some few minutes, the patient, or let's say after a few minutes of taking the injection, the patient cannot feel the leg again. You know, in this case, it is not normal because after IM injection, you should feel your leg and everything should be okay. So after IM injection and you can't feel your leg or you feel numbness, it is an imminent something. It's not expected. It should be taken care of and it should be given the topmost priority over someone who is having pulmonary edema and having dyspnea, because dyspnea is expected in pulmonary edema. So though we have our ABC, but these are some exceptional cases. Okay. So I think we look out for all of these things. So when we say look out for cues in the question, that indicates a patient is in distress or immediate danger. That is what we mean. Okay. Patient is in distress or immediate danger. It's very important when you are prioritizing. And in fact, all answers on the end list, when you are choosing them, prioritize them. It increases your chance of getting everything correct. Okay, so we can give examples. Let's say vital signs. Okay. If you have like the pulmonary edema with dyspnea, and like I said before, if you have someone against someone who was being monitored, who was on, let's say, propanolol or labetalol. So after taking it, few minutes after that, you see the patient heart rate around 40 or blood pressure massively low. Okay, so that should tell you that these things are imminent changes and they all go higher or above. They are prioritized above someone who is already having a long-standing pulmonary edema and having respiratory distress. All right. You can give similar examples in terms of laboratory values and some others. Any question on this one before we move on? Any question? Mr. Idris, if you can hear me, can you mute up, okay? All right, if no question, then I think we can continue.
Can I say we should simply obey instructions? Mute yourself, please, just so we could all concentrate and then understand what's going on here, please.
Yeah. So, for the sake of controlling that, I'm going to mute everyone. Okay, in case you want to talk, you raise up your hand. Okay. So it's going to be a setting down. You can't mute yourself if you are going to raise up your hand.
Okay. So I think we should move on to the next one. Now, consider Maslow's hierarchy of needs. Consider Maslow's hierarchy of needs. This is also very important, especially when it comes to some psychiatric questions and maybe some others. Okay, this one, so I'll try and see in each case if I can give some example for us to understand very well. So, as it reads, after all, I think every nurse here knows Maslow's hierarchy of needs. We know them, right from physiological, we can give an example, social, security, I mean, up to self-actualization. We can give examples. And we know that among all of them, the physiological needs are the most needed. Mhm. They are prioritized over all of them. You can't do away with them. So Maslow's hierarchy of needs is a model that helps prioritize patient care. This model states that physiological needs such as food, water, and shelter are the most basic and must be met needs, okay, before higher level needs such as safety, love, safety, love, self-esteem, and the rest can be addressed. So let me give you an example here so that you understand how the Maslow's hierarchy of needs are applicable. Sometimes the nature of the question that will be presented before you, it will even be difficult for you to think and associate it with Maslow's hierarchy. But let me draw your attention to some of them so that you'll be very conscious. That is why you need all the attention whenever you are doing your test. For those of you who joined more than a week ago, I reposted some things when you are doing your test, what you should do. You only open your test when you are ready to do. Don't do it in bits. You do it exactly as you are doing your NCLEX exam. That scenario we've described in that writing. Please, if you are here, you are not following. You are not doing yourself good. Okay, so try and follow. There's a reason for it. It helps you. Let's look at something here. Let's say they give you a patient who has bipolar disorder. Okay. And at a point in time, this patient is hyperactive, pacing here and there. And they ask you as a nurse, what will be your priority action for this patient? Okay. First of all, let's say one option is like put patient in a seclusion room. Okay. Then another option like try to set boundaries for patients. The next one becomes like try to talk to patients, okay, that patient would not bring any good thing to his or her medical condition or psychiatric condition. Then the last option is like give patients maybe any finger food. Sometimes they can give you an example of the food, or they can just say give patients finger foods. So sometimes you ask yourself, patients who have bipolar and is pacing around, how can you give these patients finger foods? This patient is pacing around. You might think that you need to do something very, very much important to help patients with the pacing and the rest. But in this scenario cited, the answer is give patients finger foods. So someone will sit down and be like, hey, the English is very, very difficult and it's like you can't predict them. So it's all about content, like what we are discussing now. Okay. You see, that is the scenario I just cited. That is a clear example or a clear way of how you can utilize the Maslow's hierarchy of needs. You know, people with bipolar disorder and in the manic phase, okay, they are pacing here and there and hyperactive. They are not likely, or let's say they are unlikely to take in food. They are unlikely to take in food. So we care for their physiological needs first before any other. Okay, we have one which surpasses all. That is if patients act or patients imminent acts. I mean what patient is currently doing is should I use the word tantamount, whether it's a correct English also. Or so what I mean by what I'm trying to say is that if patient is in imminent danger to him or herself or to others, that one we prioritize over all because we want safety. If the patient is not alive, you can't do any other thing. So anything just to keep patients alive or other patients also alive. So that one we prioritize over any other thing. But if nothing has been described in the question that patient is in imminent danger or danger to other patients or other staffs, then you go in for physiological if only there's an option there which speaks of it. So that is one clear way you can utilize Maslow's hierarchy of needs. The next one, think about the nursing process. The nursing process too, we are all much aware of it. We know of the term, right? ADPI. Assessment, sorry, let me use this pen. Assessment, diagnosis, planning, implementation, and evaluation. So the ADPI, I think that is what has even been stated here. So you have to use them. You have to make sure you utilize them very well. It will help you. So what clue does this point also gives us? In all options, try to assess your situation. Assessment is the key. Because if you don't assess well, you are going to end up creating lots of problems for yourself. In questions and even in real case scenarios, you're going to end up, just imagine going to give a beta blocker, especially a non-selective one, of course. Going to give a beta blocker without assessing patient's pulse or heart rate. Okay. If who betides you and this patient already has an outstanding bradycardia, you know what you are doing to these patients. You might be pushing these patients to the grave. Okay. So even in real case scenarios, we should, as we learn for NCLEX, we should also try to understand everything that goes on around our patients. Medications being administered, being prescribed, we should be much interested so that we can question some of them. Because sometimes our own medical officers and our doctors, they make mistakes. If only you have a clear proof, you can talk them out, okay? So use the ADPI, okay? There are some questions too that they will indicate that assessment has already been done. Okay, I normally use this question in cardiology to cite an example. They will be like, you are caring for a patient in the telemetry unit and the patient's patient's cardiac monitor showed or displayed ventricular fibrillation strip. Okay. You went to the patient and found that patients had no pulse. What will be the next action? And in the options, you find an answer like assess pulse, okay, or assess patient's pulse. In this case, it can't be correct because in the question, they've already told you that patient has been assessed and found to have no pulse. So why assess for pulse again? So this comes back to our first slide where we said, try to read the questions and understand. Read the questions word for word and understand. Because if patient has been assessed and found to have no pulse, why assess pulse again? It means we passed that stage. So you move on to the next one. Okay. So always watch out for that. So you see when someone asks you, I need some tricks in answering English question, you don't need there's no one-way trick. Okay, there's no one-way trick. I think there was a time I even wanted to challenge you. I have something I think I initially used to do. The whole of last year I didn't do it. But I think last 2 years I did it to some people. I have only one some short notes, one English topic. I can give it to you and give you ample time to go through. I can give you about, let's say, 10 questions. It's a very short, I think it's even less than a page. Should it be a book? It's even less than a page. I can give you 10 questions from that side alone. And it will be difficult for someone to even score. I don't know, but for most people, it will be difficult for you to score even 6/10. Okay. Let's see. Maybe within the week when we have time, I'll just put it there so that we try. So what am I trying to say right now? What I'm trying to say is that try and pay attention to questions well, because there is no one way procedure to follow to answer questions. One, you need some content, okay, then with practice, then some clues, paying attention to some clues. Some are what we are pointing out, okay. I think I don't know whether we did it in this class. Strategies in answering English question. I think we've done it already, except for the new ones who just joined us. You see, we learned some others too over there. Some might be common to us, but some also draw attention for us to pay attention to some things. Okay. So think about the nursing process and use this framework to guide your thinking about how to prioritize your care. I won't say much about it again. Now let's look at the next one. Look for options that address multiple needs. Look for options that address multiple needs. Sometimes you can prioritize patient care by selecting an option that addresses multiple needs. For example, administering pain medication to a patient with severe pain may also help improve their breathing and circulation. I don't know if you understand this point well. Okay, so let me see whether I can also cite an example for this. Okay, so let's look at this example. Let's say you're caring for a patient. This patient has MI, which is myocardial infarction. This patient has myocardial infarction, and the patient is complaining of chest pain. So I'm listing out this. Let's pay attention to them. Let's say there's chest pain, there's dyspnea. What else can I add? Chest pain, dyspnea. Okay, let us land on these two things. Patient with MI complaining of chest pain, and there's also dyspnea. And they ask you, what will be your priority or your priority action for this patient? So one, if they give you give 100% oxygen via non-breather mask at a flow rate of 15 liters per minute. And they give you another option like give 5 milligrams of IV morphine. Among these two options, which one do you think would be the best? Who can answer that?
Give the morphine.
Give the morphine. So some people are like, wait, I'll let you explain why you think it's morphine. But this is not, some people are like, morphine is contraindicated to MI because of the dyspnea. We know that morphine can slow respiratory rates, okay, or it can cause respiratory distress. But that is overdose or maybe the toxicity of it. But that doesn't mean because it has a tendency of causing respiratory, I mean, it can slow respiratory rates. So you won't give it in any case. It helps in MI a lot. So before I even say what I'm about to say, the one who just answered, can you tell us why in this case you give morphine? What do you think?
Right. So I think that when you give the morphine and you leave the patient with pain, you'll be able to use the muscles of respiration in addition to the accessory muscles, just to also aid in breathing adequately rather than having that pain. So if you have pain, it makes the work of breathing difficult as well. I mean, that's my view. If that's wrong, I mean, I stand to correct it.
Okay. That is it. Okay. That is it. So you see, when we say that look for options that addresses multiple needs. You see, the patient complained, according to the scenario I cited, patient complained of chest pain, so there was a pain. And there was also more respiratory distress or dyspnea. So you see, in this option, when you give only, let's say, oxygen, maybe oxygen might help in only the respiratory rate, or let's say it can only help with the dyspnea. Okay. But what about the pain? But in this case, when you give the pain, you see, it addresses multiple needs. In this patient with the MI, it could be like what our brother said. It could be that the patient is having difficulty breathing. That's the dyspnea because of maybe the pain at the chest. Okay. And maybe it's because of the pain, that's why the patient cannot even respire effectively. So when you give this pain medication, one, it's going to help with the chest pain, and the patient can be able to effectively use respiratory muscles. And the second one too, you know that if only I can remember clearly, morphine used in MI, it helps to reduce is it cardiac preload? Okay, it helps to reduce preload and reduces stress on the cardiac muscles itself. So it also helps the heart to rest a bit for it to function very well. Okay, so it plays both roles. You can find out. I think that is what it has that function too. It reduces preload. Okay. So in this case, give morphine will be high. You might be thinking, or let's say someone might be thinking that the patient is in respiratory distress. So you prioritize respiratory distress over pain. That one is true. I mean, in genuine cases, respiration before what? Before pain. But look at the scenario that we've put over here. Okay, you can't choose oxygen or something that will help with only respiration. In this MI patient, you have to deal with the pain, I mean the chest pain, which is having an extended effect on the patient's respiration. Okay, so I think that is also a clear example enough. we can relate it well. Then the last one. The last one, you don't need, as someone will say, you don't need to be told of, you don't need to be told of. It's very clear. Practice will always make you what? Perfect. Sometimes someone will be like, I'm learning and I will not, I'm learning content. I'm learning plenty content. There are lots of things to learn, and that is why I'm not doing my test also. If you are here like that, just note that practice will always make you perfect. If you are a soldier and you always learn formations and the rest, and you don't put yourself to practice or to test, how can you tell if you're a good soldier? Okay, so if you are here and you are learning planes and you are not doing any test, please, it is a cost 90. You are not doing anything. Okay. And so this one, I'm saying it to encourage, especially those who will be writing in no time. Every day, at least every day, if you have 1 month or less than 2 months, so let's say 1 month and some weeks, or anywhere less than 2 months to write. I know some people will even be writing this month, so you have less than 1 month. At least every day you should be doing between 75 to 85 questions. That should be the least you should do every day. Please, not every other day. Every day you have to do such number of questions, and it's going to help you if you're able to follow and you review every test you do before you move on to the next one. You pick up new things from in there. There is no, this one I can bet you, there is no way you will fail. So you see, the strategy and the pathway is there, but sometimes the strength that we can have to follow is what sometimes becomes a problem to us. But believe me, if you're able to practice exactly as we tell you, even if intentionally you want to fail, trust me, you will pass. Okay. So that's how it works. Any question on this slide before we move on to the next one? Okay. If no question, then I think silence means consent. We are learning some 1 or 2 things there. Let us refresh ourselves with this one. So let's look at this question. We have another aspect of the prioritization to talk about. Okay, but before that, let's look at this one. An hour after admission to the nursery, the nurse observes a newborn baby having spontaneous cheeky movement of the limbs. The infant's mother had gestational diabetes mellitus during pregnancy. As a nurse, what's the first action you should take? So you have about 2 sentences, right, as the preamble. Whenever you are reading questions like this, I think when we were doing strategies in answering English style questions, I told us, those of us who were present, I mentioned it. I said most of the times, like most of the English questions, they come in 2 sentences. Not all, but most. The first part, please, I'm talking about the standalone questions, not the NGN, the case study questions. So the first part will mostly talk about the preamble, what is happening. Okay, it gives you a fair idea of the situation. Then the last part will come the question itself, what they want from you, not what you think the answer should be, but what they want from you. Okay, because there are some questions, you can do lots of things, but ask yourself, what do they want from you? That is what you should give them, not what you think it's important for them. So let's pay attention to this part. So an R, so you read the question with understanding. An hour after admission, so there's a reason for giving you all these details. An hour after admission to the nursery, the nurse observes a newborn having spontaneous jerky movements of the limbs. So you ask yourself, even before you continue, you ask yourself, what could be causing these jerky movements? Then you'll be like, well, let's see the additional information added. So the question will be like, the infant's mother had gestational diabetes mellitus. And you ask yourself, how does this one relate to jerky movements of the baby? How does gestational diabetes relate to jerky movement? Then over here, your content will come in. If you've never learned anything about diabetes, or especially, let me say diabetes, how can you even relate this form of diabetes to the jerky movement? So at least if you've learned something about diabetes, you know what, or you can suspect, even if you're not sure, you can suspect something happening here in relation to the diabetes. Then they ask you as a nurse, what's the first action you will take? So before we even look at the answer, can someone try? You can raise up your hand if you want to try. Taco, Jimia, your hand is up, let's go.
Okay. Yeah, greetings to everybody. So let me attempt the question. Actually, this baby is checking due to I think due to hypoglycemia, because the child was subjected to high amount of glucose, and the child is used to producing high amount of insulin while the baby was in the mother's uterus. So the baby came out and is no longer subjected to the high amount of glucose, but yet it's still producing that high amount of insulin. That only means that the insulin that the baby is producing is going to is going to convert the remaining glucose in the child's body. So that child will obviously have hypoglycemia. So that is why the nurse should determine the blood glucose of the baby. That's the first action the nurse should do.
Good,
Yeah.
good, good. You've answered perfectly. So in this case, the answer should be determine the blood glucose level. So you see, it's exactly as you said. Babies who are born of mothers who had gestational diabetes, normally after a few hours of delivery, they have or they are predisposed to this hypoglycemia episodes. Okay. So the jerky movement, you see, they didn't tell you in the question that patient is having hypoglycemia, but they just gave a symptom. And they've given you, so you see how the interest will relate to some of these things. Okay. But you see, like we said, you remember the slide which told us that in everything we should make our assessment first, the nursing process. I think you still remember, right? The nursing process. So you make your assessment first. But please, you see, jerky movements will happen not only with gestational diabetes, sorry, especially with hypoglycemia. You can get other conditions that can also give you jerky movements. But in this question, they've given you a clue that patients had gestational diabetes, and now the baby is having what jerky movements. So you at least you should suspect hypoglycemia. So if you want to rule out whether it is coming from hypoglycemic cause or some other cause, what do you have to do? You have to check your blood glucose so that you'll be able to rule out, because the baby is a candidate because of the gestational diabetes status of the mother. The baby is a candidate for hypoglycemia. So you check the blood glucose. If the blood glucose is fine, then it could be maybe a form of seizure from a different cause, whether from congenital cause, brain cause, electrolyte imbalances, or any other thing. Okay, but they've given you a clue. So the preamble given before the question. You see, in this case, the preamble, all of these ones were the preamble. Then the question was this one, the last sentence. Okay, so all these things were given to you so that you get a clue of what is happening. So let's pay attention to it. So the answer is check blood glucose level. Who doesn't understand this? So that is the rationale and the answer. We can look through it. If you have any question, you can ask. Okay, if not, then we can carry on. Now, there are some other things to also look out for when you are doing prioritization. We have a saying that goes like, unstable beats stable. What we mean by unstable beats stable means that unstable conditions will always be prioritized over stable conditions. That is what this one means. So let's look at this one. Words that make you stable. Some of the words, when mentioned in the question, will predict that this patient is stable or not. So the first one we have here is the use of the word stable. So when the question tells you that the patient is stable, please don't think the patient is not stable. The patient is actually stable. Let me give you an example. Let's say, let me still use my pulmonary edema. They tell the patient has, so they tell the patient has pulmonary edema, and or let's say patient had pulmonary edema some few days ago, but is stable now. Please don't go and say because patient had pulmonary edema, you still consider it to be an emergency. The person is telling you that the patient is stable. So why still fight your way to put or to bring back the pulmonary edema? So that's what we are trying to say here. If they use the word that patient had descent, now stable, please, it means the patient is stable. No two ways about that. The second one, chronic illness makes you stable. Though chronic illness doesn't mean you're stable, though. But in terms of prioritization, you will not prioritize chronic conditions over acute. Okay. So that's what the second point is also trying to say. Someone who has COPD, let's say emphysema, someone who has emphysema and is not demonstrating any form of emergency, you can't prioritize this patient over someone who is even having an acute headache. The person who is having an acute headache or a headache which started a few hours ago will be prioritized over someone who is having emphysema. So that is what we are trying to say here. The next one, post-op greater than 12 hours, you are stable. So when, let's say, among patients who had gone for surgery, patients who had gone for surgery are to be prioritized. So if such patients are to be prioritized, note that if only the question indicated that patients return from surgery, maybe 12 hours ago or 14 hours ago, please, it means the patient is stable. So you can relate this one to among these nurses, like let's say if they give you between LPN UAP and an RN, who can, let's say, the UAP care for? You know, the UAP cannot care for someone who is within 12 hours. Okay. Or yes, who is within the first 2 hours post surgery. So you can only give patients after patients who are 12 hours after post-op. Okay, 12 hours post-op to UAP to care for, or maybe LPN. But if they are within the first 12 hours, it is the responsibility of you, the RN, to care for this patient. So you can relate in this case. So people who are within 12 hours, within 12 hours are unstable, but after 12 hours, it means you are stable in terms of prioritization. The next one, procedure with local or regional anesthesia. So in comparison, you know, if it's not local or regional, it could be what? It could be what? If it's not local or regional, it could be what? Or everybody has been muted. Okay. So if it's not local or regional, then it could be general. That's what I'm trying to say. So if patients has not undergone general anesthesia and it's rather local or regional anesthesia, then it means that patient is not a major priority compared to someone who has undergone a general anesthesia. The reason is that when you undergo general anesthesia, you know, because you are put to sleep, everything is paralyzed. You are sedated before you are paralyzed. You don't normally have, at the initial stage, you don't normally have control over your respirations. Okay, so when you are coming out small, you have to be monitored. And this is not the work of the LPN or the UAP. It is the RN who is supposed to do all of this work. That is why people who undergo procedures with local or regional anesthesia are not considered, unstable. Okay. So the next one, lab abnormalities of an A or B level. So this one, let me give an example. Let's say if you have a questionnaire and they give you maybe let me use potassium as an example. When you have potassium level of, let's say, 3.4 compared to potassium level of 2.5, which one do you think will take priority?
Two point five.
2.5.
2.5. So over here, we are talking about the extent of abnormalities. Okay. So let's say in vital signs too, you know that the normal heart rate for an adult is between 60 to 100. But when they give you a heart rate of, let's say, 50 or 55, and there's no indication that patient is demonstrating bradycardia or exhibiting bradycardia, it is a cause for no concern. It can be looked over. Okay. So that's what we are trying to say. So lab abnormalities which are not extreme, you don't bother yourself too much. It means there could be something among the options which will be the answer, but not someone who has a potassium level of, let's say, 3.4. Okay, or even if in the hypers, you know, the hyper or the upper boundary for potassium is 5. Okay, if they give you even 5.1 or 5.2, look at the other options well, because it could be of no priority. There could be something which could be more dangerous among the options given than these small differences. That is what the 0.5 is trying to say. Now the 0.6 says the phrases ready for discharge. You know, you can't discharge someone who is not doing well. So when you get options that include maybe the patient was something. They started with something big. And the question, or let's say the sentence ended with, and now ready for discharge. Please, it means the patient is ready to go home. The person is okay. It means the patient is stable. Okay. Then another one, if the patient is been admitted longer than 24 hours ago, then it means the patient is not unstable. Okay. The patient is not unstable. It means the patient is stable in quotes. Let me say that. And for this matter, it is a cause for no concern if you are prioritizing. The 7 points here, unchanged assessment. What the unchanged assessment here too means is that, let's say a patient came in with respiratory distress, and the patient has still been having this respiratory distress. It has been the same throughout. That's what we mean by unchanged assessment. It means nothing has happened critically. But let's say if they tell you patients who was having dyspnea has exacerbated, or let's say dyspnea has gotten worse, or if there's, let's say there was an already existing pain, and now patient tells you that the pain has worsened. That's a changed assessment or a changed something. And that makes it what? Very critical and unstable. But if patient has an unchanged assessment, then it means the patient is in quotes stable. Okay, that is what we are trying to say here too. Okay. Then the last point here on this slide, experiencing the typical expected signs and symptoms of the disease with which they were diagnosed. When I was giving the example pertaining to pulmonary edema, you remember what I said? The example I cited. When you are dealing with pulmonary edema, you know that definitely they will have difficulty breathing. So when you have options like, let's say you have a question, the nurse is caring for a group of patients, which patients will the nurse prioritize first? And you have an option like patients with pulmonary edema and experiencing difficulty breathing. You know that people with pulmonary edema, they would definitely, or pneumonia, they would definitely have difficulty breathing. And it's expected. But let's say when they tell you someone with varicose vein, someone with varicose vein, or no, yes, let me say varicose vein. And should I say varicose vein? Okay, let me use a different condition. Let's say someone with DVT. That one will be better. A patient who was admitted with DVT now complains of chest pain and difficulty breathing. Chest pain and difficulty breathing. You know that when you're having DVT, you should not get difficulty breathing because DVT has nothing. If it is only DVT, it has nothing to do with what difficulty breathing. But if patient has DVT and is now complaining of difficulty breathing, then it can only mean one thing. It means the clot has dislodged or might have dislodged, if not all, some might have dislodged from the source of the DVT into the lungs, or probably maybe even into the chest. When I say the chest, I mean the heart. Okay. So that is not expected. And that is a sudden change and should be taken care of. That should tell you that patient is now experiencing what? Pulmonary embolism or something, if it's only in the lungs. Okay. So that is how you should relate your answers. And how can you tell this? Unless you have the content. So those of you who are doing shabby reading, please don't do shabby reading. Okay. Let us the notes that we've given you, they are already summarized. I know some of us, we are already complaining that they are plenty. Please, what I'll tell you is that if you think the notes we are giving you is plenty, then look at Sanders. Maybe you'll be hopeful a bit, okay? And you see that most of what we are giving you, those of you who have been learning the notes, please, if you are here, I'm repeating this. If you are here, you've not printed the notes, it is not better. Try and get a hard copy of the notes. Those of you who have been using it effectively, you will see that every line, almost every line or every sentence, has something small to tell you, and it adds up to your content or your knowledge. Okay, so let us take it serious. We know why we are giving you these notes. It's very concise. So don't scan it. Okay, I mean, what I mean by scan it is don't scan, read it. Actually learn it. And I'm repeating myself, get hard copies of them, buy pencils, then use it to learn. Okay, note certain points and enrich yourself with endless content before you go and write, and you will pass. So I think that is also how best I can explain the number 8. I've done that right now. If you have any question on this slide, you can ask before we move on to the next one. Mr. Osman, you can ask your question.
Yeah, with regards to the phrases pertaining to discharge, I've come across a question whereby they stated that the patient will be discharged tomorrow. So in this case, how would you classify that case? Thank you.
Hayden, come and close my door.
I should come and close your door, eh? Sorry to you. Okay. So, Mr. Osman, if the patient will be discharged tomorrow, then it means patient is also stable. Okay. Most of the times, most of the times, I mean, let me say about 80 to 90%, it means patient is stable. Because if only patient will be discharged tomorrow, it means an agreement has been made and it has been certified by the doctor. It's not any guess. It is the patient is ready to go home tomorrow. But there's an allowance to some extent. So it depends on the, is it like those of you who have been listening to Mark K or Mark Lemick, he will always say it depends because there is no one-way trend on this thing. It depends on the options that you've been given to compare with. It is always options that you've been given to compare with. Okay. So there's nothing like one way. So let's say someone who has been or who is to be discharged tomorrow. Kindly mute up. Millie. Okay. So let's say someone who is to be discharged tomorrow. Though we know that there's some extent of what? Some extent of stableness, if only it's a word. But there's an extent that the patient is stable to go home. But it depends on what is being asked in attached, whether for this patient, maybe the UAP can care for this patient, or they can ask it in different ways, or what they expect in this kind of question. But in regards to whether they are stable or not stable, I would say it's more stable. Please, are you answered? Have you been answered?
Yes, thank you.
You're welcome. Please, any other question? All right. Let's move on to the next one. So this one too, where that makes you unstable. So when you get these things or you are experiencing this, it means you are unstable. So the first one is very easy. When the question itself tells you that the patient is not stable, please, no matter how nice you see the situation being described, it means the patient is not stable. I'm repeating myself on that. If the question mentions that patient is unstable, no matter how nice you think what has been stated is, it means patient is unstable. So take it like that, okay? The next one here is that acute illness always makes you what, unstable. What we mean by acute illness is that like conditions that happen suddenly. Okay, conditions that happen suddenly. Let's say patients who had sudden chest pain or sudden headache with, let me use the headache as an example. Sudden headache with vomiting about 2 or 3 hours ago. It's an acute condition. Okay. Anything less than 24 hours, it's an acute condition. And for that matter, we have to investigate. That is more acute than someone who has been having a long-standing condition. No matter how bad the condition is, the patient is stable for chronic conditions. Okay, then the next one. Post-op less than 12 hours makes you unstable. Post-op less than 12 hours makes you unstable. So let's take note of that one too. I think I explained it better when we were doing the stable one. Okay, so when you are within the first 12 hours, we assume you are not stable, so you have to still monitor you closely. Then the fourth option, general anesthesia makes you unstable. General anesthesia, that one too, we spoke of it. It makes you unstable because of risk of respiratory compromise. Not actually respiratory compromise, but risk of respiratory compromise. That is why you can become unstable. Not even respiratory alone. It could even be cardio, because within, most of the anesthesia drugs used can cause hypotension too. They can dilate blood vessels and the rest. Okay. And depending on the surgery you did, if it's an abdominal surgery and the rest, I think CO2 is there, which can also dilate vessels and the rest. All right. The fifth point, lab abnormalities of C or D, that's higher level. So I think we did the comparison, talked about it. If you're having a potassium level of, let's say, 6.5, that is extremely high. Okay. You know that it's a cause for concern. That it means you are unstable. All right. The phrases, not ready for discharge. Not, so pay attention to these phrases. When the question tells you that the patient is not ready for discharge, it means the patient is unstable. So not ready for discharge means unstable. Let's take note. Then newly admitted, it means the patient is unstable. Newly diagnosed, newly diagnosed, it means patient is unstable. The next one, admitted less than 24 hours. A patient who was admitted less than 24 hours. This patient too is unstable. Then changing or changed assessment. Changing or change assessment. So when you have that one too, it means patient is unstable. Like I was trying to say, when you have sudden change in, let's say, blood pressure after giving a particular medication, or you have sudden change in condition after performing a procedure, or even patients without performing any procedure, like, I mean, even if there's a sudden change in condition, that's also an acute something that should be taken care of. It means patient is unstable. And the last point 8, I think it's continued here. So the point 8 says experiencing unexpected signs and symptoms. I give an example. Okay, I give an example. Like someone with DVT. If you have DVT, think you have this swollen leg and you have heat around, there will be pain around the feet and the rest. But DVT should not give you respiratory distress or difficulty breathing. So when you have someone with DVT and is now complaining of difficulty breathing, please, on the end list, this one I can even say it is 99% always like that. When you see DVT anywhere or someone who has recently gone for surgery, abdominal surgery especially, and patient is now complaining of chest pain or difficulty breathing, think of clots. Think of clots in there. This one is always like that. I mean, that is one key in life, in real case scenarios and exams. It is, I mean, it's like that. Okay. And whenever a major bone has been manipulated, let's say a hip surgery has been done, and you find out that patients, maybe hip surgery was done because of maybe a fracture, and now patient is complaining of difficulty breathing, you see some petechia rash. Okay, when we say petechia, P-E-T-E-C-H, it is E-E, petechia rash, okay, or ecchymosis. It's more of, there's a slight difference, okay. The ecchymosis is like they are wider and they are joined more than the petechia, which you see them like dot in there. If you see any of them after a major hip surgery has been done because of maybe a fracture, this one too you can suspect fat embolism straight away. Okay, and how do you get to know some of these things that we talk about? When you see ecchymosis around the flank area, I think that is cooling sign, right? C-U-L-L-E-N, cooling sign. What does it mean, or what can it indicate? Pancreatitis. We have another sign for it. Most of you will remember, think you can tell. So how do you gather all of these things? It is by practice. Okay. So you have to learn. How you see people answering questions on the pages, it depends on everyone. But what I want to tell you today is everybody started from a point. And if you work hard, you will get there. This journey is personal, okay? We all come together to help ourselves, but you will have to sit down and learn. There's no shortcuts. So that's just to add that. If you have any question on this slide, you can bring it out. Any question or any addition? Today I've been talking plenty here. Don't worry, it will get your turn too very soon.
Hello?
You didn't raise
Hello?
up your hand.
Can-
Yes.
Okay,
Okay.
please. Hello, please. I think on the first one, the under the unstable bit stable, you have to have abnormalities of A, level A or level B. And this one we have lab abnormalities of level C or D. It's like this. Can you throw more light on it for me? Okay.
Did you just join?
No. But please, it's like you were saying that the unstable one, that one, it's like this one, the level C or D is more severe than the level A or B. So it's like I want examples.
Okay. So I think I said that earlier on, but well, let me try. I try to make it simple by demonstrating examples. Okay. I don't know whether you were with us or not, but when we talk about level A abnormalities, or let's say yes, level A abnormalities, what it means is that patients, I mean, you should do nothing. Okay. Level A abnormalities, do nothing. It means it is fine. And I gave example. I gave example like let's say if you have a potassium, if you have a potassium level of 3.4, you know the normal potassium level is between 3.5 to 5. So if you have a potassium level of 3.4, though it is abnormal, but it's not a cause for concern. Okay, it's not a major cause for concern compared to let's say a potassium level of 2.5. Okay, that one is way too low. Okay, that was the example I gave. So in short, the level A means normal. I mean, so level A means though there's abnormality. Okay, abnormality A means, I mean, is there, but I mean, do nothing. Okay, please are you there? And the B means that
Yes, please.
be concerned. Okay, be concerned. So you assess and you monitor. And for those options, if the patient is not experiencing the effect of what is happening, it can be spared. So like let's say bradycardia. If patient is having bradycardia and let's say heart rate of 55, okay, though you are concerned, but you have to assess or you have to monitor and see if patient is demonstrating what he or she is showing on the cardiac monitor. So it's like the A means abnormal. Okay, that means do nothing. B means let's say be concerned. And that is what I'm saying, that with that one, you have to just assess and monitor and see. So let me come back here to this slide. So you see level A means though it's abnormal, okay, but you don't do anything. B means be concerned. Okay. You assess and you monitor. The example is what I just gave with respect to the heart rate. Then with the C and D are the highest of all. Okay, so the C, you can use critical to represent the C. And it means you should do something. You know, if something is critical, you should do something. Okay. And the D is the highest level. It means it is deadly. And that one, it can't wait. If you wait for D, so let's say you can use deadly, okay, to represent D. You can use deadly. Or maybe dangerous. That one you should do something immediately. It can't wait. You should do something now before anything happens. But I try to explain it in the other way around so that you'll get the understanding of. So in aviation, it's like abnormal, be concerned, critical, deadly. Please, you understand it now?
Yes, please. Thank you.
So with the D type, let's say you have a potassium level of, let's say, 7. Can you just imagine? If you have a potassium level of 7, if it's just going, you can't, you have to immediately do something. It's very, very dangerous. Patients can arrest immediately. So those are the D levels we're talking about, okay? And C2 is critical. That one too is there. Please, are we okay now?
Yes, please. Thank you.
All right, you're welcome. Please, any other question before we look at this one? So, any other question? Okay, so in prioritization, there is another thing to consider. You see, we are looking at. Kaiser. Caesar or Kaiser? Okay. So in prioritization, the organs to also prioritize. So in this order, your brain is the most, you don't say an organ or one organ is most important than the other. But in prioritization, your brain will take the priority. That is why sometimes when you have, especially in critical care settings, when you have all aspects of someone's body working and the brain is dead, sometimes we have a term we give you. You are a vegetable. Hey, who is this? I remove this person and this person can't join again. No. Okay. All right. So brain. When the brain is dead. Let me remove the person. Let me remove the person. Okay. All right. Now we can continue. So with the brain, like you're saying, the brain is there. The brain controls every other organ in the body. So you can have the lungs functioning in some way, heart will be beating, everything will be functioning. If the brain is dead, you can never walk. And you are considered, in quotes, a vegetable. Okay. That is why sometimes when we have this test we normally do, brainstem reflexes, especially in critical care settings. Brainstem reflexes, I think there are 6 or so. They are used to confirm whether a patient is brain dead or not. If a patient is brain dead and other parts are working, normally relatives are cancelled if they want to give up, because this patient will rather incur cost. And if the brain is dead, nothing can be done to replace it. If the brain is dead, is dead. In fact, your makeup and your everything is in your head. It's what I mean by it's in your head is in your brain. So I just want to project the brain in a way that you'll understand it better. So the brain is you, and you are your brain. Okay. That is why the brain is the highest one. And it is for the same reason why when someone gets let's say cardiac arrest, you should intervene with your chest compressions faster, because the more you delay, then the higher chances the person is likely to get hypoxic brain injury. So when a CPR delays, you can get the patient back, but the brain will be suffering from hypoxic brain injury, and that could lead to brain death. So you've done your CPR, you've gotten patient back, but patient is brain dead, or patient has hypoxic brain injury, which is very difficult to fight. And though you've done well, but to what end? Okay, and we know that, I think most of us here, we can attest to it. There are lots of cases where you can do CPR for people and they will come back, they will get well from their medical or surgical conditions and they'll be working. Okay, so timely intervention is very important when it comes to cardiopulmonary resuscitation. Okay, that's just by the way. So after the brain, then the lungs will now follow. So in that order, the heart comes next. So you see how they are prioritized. The liver before the kidneys, then the pancreas becomes the last. So we have an exception here. With the exception, the exception is that if there is a scene of unwitnessed accidents, and if someone is pulseless or breathless, they are low priority. Why do you think they are of low priority? Hello, are we here? Why do you think they are of low priority?
Because I think nothing can be done about them. Nothing can be done for them as at that stage. Or
Is that Leticia?
That's
Okay,
Rachel.
that's Rachel. He said nothing can be done for them. I should nothing can be done for them. I want a certain thing. Okay, so Leticia.
The person
Yeah,
is
black.
Yeah, they are black tag. The person is dead. Okay. If someone is not having any pulse, if it's an unwitnessed accident, that's why we said if it's an unwitnessed, because you don't know for how long the person has not been breathing. And you don't know how long the person has not been having pulse. So those are black tags. There is no need for you to waste time on them. Go in for someone who has a pulse and is suffering from other things and help. All right. I think we are getting somewhere, small. Let's look at the next one here. Okay, so 3 things that result in black tag of an unwitnessed accident. So like we have here, you see if there is pulselessness, if there is breathlessness, and if patient has fixed and dilated pupils, they are all black tags. Okay, in terms of burns, 80% and above, 80% and above, they are all black tag. Even if the patient is talking to you, especially with the burns, the black tag. All right. Things that are always unstable, regardless whether it's expected or not. So you see, the previous one we said expected. Sometimes when you have a condition and you have some expected symptoms, you don't prioritize them. Okay, over the unexpected ones. But we have exceptions too. So these are the exceptions. Let me give you an example so that you understand this one better. If you have a puncture wound, abdominal, let's say a traumatic wound, a puncture to the abdomen, and you are bleeding. Of course, when you have a puncture to the abdomen and you are bleeding, it's normal, isn't it? I mean, it's normal in such a way that you should bleed when your abdomen is punctured. That's the normal one I'm talking about. Please, you get what I'm trying to say. But in this case, it is not normal. Okay, let me give you another example. Let's say you have let me use this medical condition, hemophilia. You know, with people with hemophilia, they hemorrhage. Okay, they can't clot easily. And if this patient is hemorrhaging somewhere, though it's expected from every hemophilia patient to have some hemorrhage. Okay, but you don't expect it to happen. I mean, you will not consider it to be stable. That's what I'm trying to say. Because though they can't clot blood, they have high tendency of bleeding, but you don't expect them to bleed. So when they are bleeding, you don't treat it as expected. Okay, so when they are bleeding, it means they are unstable. Please, you get the idea I'm trying to put up here. Then the next one, when you have high fever over, this is in degree Fahrenheit. Who can convert it to degree Celsius for us? 105 minus what? Who can tell us 105 minus what?
32.
Divided by
5 divided by 9.
divided by 1.8. Okay, that's one easiest way of conversion or converting temperatures from degree Fahrenheit to degree Celsius. You subtract 32 from the temperature, then the resulting answer you divide by 1.8. You get the same in degrees Celsius. So this is more like 40. I think those of us in UK and US, you normally use the degree Fahrenheit more than the degree Celsius. So in degrees Celsius, it's 40.55, something like that. Okay, so when you have a higher temperature of such value, it means you are not stable. Okay, when you are hypoglycemic, so that means that even if you have diabetes and you normally have episodes of hypoglycemia, at this point where you're having hypoglycemia, it is not a normal thing. We still have to treat you. Okay.
Hello. Hello.
Yes.
Thank you. This the temperature condition that you just calculating right now. But please, can you go over again, because that formula is simple.
That formula is simple. Okay. So when you want to convert degree Fahrenheit to degree Celsius, this figure, the figure, you can try with different figures. Just subtract 32 from it. And the answer you get divide by 1.8. That's all. It's very simple. It is simple than that formula where you get
Please, 1.8.
Yes, you divide by 1.8. So when you want to convert this 105 degree Fahrenheit to degree Celsius, you subtract 32. Okay, so this one minus 32. Then the answer you get, you divide by 1.8. Okay, so you can try with different figures and find out. You get the same. I mean, even with the decimals, you will get the same decimals. No approximation. It's exactly like that.
Okay, thank you.
Okay. You're welcome. Any other question? We are now moving to.
Otherwise, we want things from degrees or shelf to Fahrenheit.
Would you even have to change it? You either be giving from one, like you'll be giving one, okay, and on the end case, I've not tried that formula to do. Personally, I've not tried from degrees Celsius to Fahrenheit. But even on the English, you'll be giving both. Okay. So you don't even have to worry about the conversions. But I think someone can try, unless I sit down and see how it is. But I can't tell you right now how to convert back from. So it's like, wait, so if from degree Fahrenheit to degree Celsius, you are subtracting 32 and dividing by 1.8. Then it means if it is in degree Celsius, you can multiply by 1.8. Then after add 32 to it. It should give you the same answer. I think that is the reverse of it. You can try and see. So the one who just asked the question, 40.555. Multiply by, you can do this backstage and come and tell us right now. Multiply the 40.55 we had. Multiply by 1.8. Then after add 32. And let us see. What will you get? Whether you get the 105 back. So I think this is more of mathematics. Okay.
Yeah, you get the same answer. It's correct.
You get it. So it's like it's more of mathematics. Okay. This is just by the way. Let us continue. So let's take note of these ones too, okay? Things that are always unstable regardless of whether it's expected or not. So you can see it here. All right, let's move on to, we'll be trying some before we close today. And please, when we get there, everybody should participate for your own good, okay? So the last thing we will do before we will start our trials, the last thing we will do. So you see, for all that we've spoken about, there's another way of also keeping this updated in your minds when it comes to prioritization. That's the Serum method. The Serum method. So Serum here simply is an abbreviated word. So S, kindly mute up, please. So S for stable versus unstable. So when you get prioritization question, check out and see whether you have stable versus unstable. Then the next A is what? Acute versus chronic. And remember, we said acute always beats what's chronic. So they have these things in mind. The next one, ABC compromise. You know that airway is prioritized over breathing, and breathing is prioritized over what? Circulation. So ABC compromise. We check for this one too. Then the R here, you examine whether the symptoms the patient is exhibiting is real or a potential one. Real one here means that is the patient now undergoing it, or it's a projected something that patient can undergo or patient can experience. Okay. So real here means that the patient is currently experiencing it. And the potential means that patient can get it, but has not gotten it yet. So in this case, you prioritize the real over the potential. That is what this one too is saying. Then expected versus unexpected. That one we just discussed that one. Okay. You examine to see whether what patient is going through is expected or not expected. And most of the times, like the examples I gave with the fat embolism, the blood clots, DVT example I gave, it can be an example. If you're having DVT, you don't expect respiratory difficulty. If you're experiencing it's unexpected, and that means that something new has happened, and attention has to be given to it. Okay. And the last one here is Maslow's hierarchy of needs. It should also be guided by it. We've talked about that one too. So this is our SRM method. If you have any question, you can bring it. Any question? Or should I ask you a question? Should I ask him a question?
Yes.
Okay. Who said yes?
Letitia.
It's a Letitia. So you'll be the first person to try. Okay. So now let us practice what we've gone through today. Okay. We have lots of prioritization. I will even advise that we use even one. The next meeting to do more, so that at least. And one thing about this thing is, as we are doing the prioritization, we can be learning some one or two things too. Okay. So that's, prioritization. No one has written a place without prioritization. So let us master it once and for all. So look at this question. Everybody should partake in it, please. The nurse is caring for a client with a central venous. Please, if you just joined us and you've not gone through lots of things, don't worry. But I think it's a good experience you are even being previewed to. Okay. You'll get there. So the nurse is caring for a client with a central venous catheter, that's CVC, who reports feeling nauseated and chilled. The nurse notes that the CVC insertion site is red and inflamed, and that the client has temperature of 102 degrees Fahrenheit. So you can use the same. So you see, this is how the English will put the question in terms of the temperatures when they are giving you. It will be in this way, okay? Or either the degree Celsius will come out and the Fahrenheit will come in. And those of you who wants to try, you can try the conversion using what we did and see whether you won't get the same thing. So it has temperature of 102 degrees Fahrenheit. Which new prescription from the healthcare provider should the nurse implement first? So if you want to answer, you raise up your hand, you tell us your answer and why you chose that answer. That is the exercise we're going to do. I'll take 3 people. I think this one is more of, sorry. I think this one is more of either fundamentals or critical care concepts. Sorry. Mr. Zifa, please, sorry, let us hear you right.
Okay, I'm choosing the answer 4. I think this is because I need to take the blood culture before starting antibiotics. Other than that, it will affect the results, because looking at the temperature of 38.8, I think there's an infection, and they are saying that the CVC insection site is also red and inflamed. So I think there's an infection that has set in. So I'll take the blood culture before starting any medication.
Okay. Thank you for your submission. There was another hand up.
Yes, it's me, but I could say down the question. So.
Okay, so let us hear from you.
Okay, with the scenario, I would choose option 4, which is obtain blood cultures and discontinuous intravenous use. With this that I read in the fundamentals, having, and even with my knowledge, I know that having high temperature is an indication of infection, especially with the scenario. And also it's inflamed. The site is red. So all these are symptoms that shows there is an infection. So then there will be a need to obtain culture to see the right antibiotics or to come out with the right prescription to use. So I think this would be the first thing that will come to play before giving any antibiotic. This is my submission.
Okay, I like that. Is there any other person? Last one. So today only the females are talking. Eh? Why am I big guys? Omada, right? Are my big guys here? Okay. Wait, let me see. Mr. Osman or Richard, any of you, do you object or you have a different say? Okay, or Isaac, anyone at all? I need a meal. He's coming. Hey. Okay. All right. If our meals are not coming, let's
Can I
continue.
come in? I just
Oh yes, you can come in.
it's a bit noisy here, but bear with me. Yeah, I'm going for option 4, which says obtain blood cultures and discontinue the intravenous catheter. So from the question, it means we have our patients having had an infection from the insertion site, well, I am going with the upper rule. So before I approach any case, I would have to assess first. And per my assessment, the site will tell me that this patient has had an infection from any possible source. So I would want to have cultures to know what sort of organism is causing this curiosity, sort of. And then knowing that would help in choosing what sort of antibiotics to give. And then it would rule, meaning that option 3, which says we should administer IV, piperacin or something of that sort, which would possibly be an antibiotic. And then I would want to discontinue the central venous catheter using the venous phlebitis rule. I mean, when you are looking out for possible infection with catheter insertion, I mean, we says we would not continue when we are observing some signs which would indicate that we have a problem with the cannula insertion sites. So, I mean, I might not make sense, but yeah, this is why I would go for the option 4, please. Thank you.
In fact, you are making lots of sense. I think we are all on the same page. Yes, so it's good. Hello, please, can you hear me?
Yeah,
Yes,
I can hear you now.
I think
I
my
think it's
my
okay
sound
now.
my sound was misbehaving.
Yeah.
So let me share my screen again. So what you are saying is true. So look at this one, the first option, especially for those of you who joined us not long ago. You see, administer ondansetron. Patient is having, because of this nausea. Remember, I told you that in every question they will also calculate for the wrong answer. So because of this nausea, that's why they brought this ondansetron. Okay, but the issue here is more than nausea. They give you indication for what? For catheter site infection. So what do you think is best to do to help with the general situation? When you document the occurrence and notify the epidemiology team, this one is like, you see, when we're doing strategies in answering this question, if we've not done it, I think we'll do it again. This one is like you are documenting what you've seen and you are sitting down doing nothing. It's like you are transferring your duty, which is not done. Okay. Initiate the first dose of peptides or piperacillin tazobactam. When you give this, how can you give antibiotic without knowing the causative organism? So you ask yourself. So that is why this one will become first. Okay. So you see, in all of these things, in one way or the other, they could be done. They could be done. But what will be your first thing to do in this case? So this is one way prioritization will come. So the answer is 4. Okay. Let us look at the rationale. I think we can add something to the rationale. Even the wrong answer is tells us something. So let's take some few seconds to go through the rationale, then continue. The answer is 4. Can we move on? Can we move on?
Yes, we can.
Yes, please.
Okay, so let's pick the next one. The next in the cardiac intensive care unit receives reports on 4 clients. So which of these clients should the nurse assess first? Who can try? I think this is one easiest way to figure out the answer, if only you follow that presentation. Miss Emilia, tell us your answer and why.
I will go for answer 2. Clients
Why?
who underwent. When we're looking at the rules, we said post-op less than that's 12 hours. We should prioritize that. And also looking at the other options, the client is receiving antibiotics already. The infective endocarditis is an infection here, but he's on antibiotics. The 3 also underwent the surgery 3 days ago. The client who underwent heart transplant 2 months ago with a sustained sinus. So this one, there is no change. So the main answer I will go for is 2.
Okay. I like your submission. Miss Anita, your hand was also up. Miss Anita.
Oh,
Let us know what you think.
That's the same explanation I wanted to give. That's why I lowered my hand.
Okay.
So I was
Last one. If I saw the hand up. Okay, Leticia. Your hand is up.
Hi,
okay.
can I talk, please? I don't know if you can hear me. I barely can hear you. My network is really bad in the trains. But I mean, if it's fine, I can talk. But if someone is on the line already, please tell me and then I would not talk.
Can you hear me?
Please.
Can you hear me?
Hello, I
Thank
can
you.
hear you now. Yes, yes, please.
So after Leticia, then you come in.
Oh, okay. Sorry. I didn't know someone was on. Thank you.
Oh, no problem. Leticia, let's hear you.
Okay, so I'll choose option 2 because the size of insertion, the coronary artery stent placement is via the femoral approach, and then it has nothing to do with back. Yes, and if any anesthesia is given, it's even local before the placement was done. So then the severe back pain is not associated with the procedure, so it becomes an urgent need for attention. So I think that's my choice that's the first assessment. So that would be the first client I would ever approach or attend to.
Okay, thank you. So the last one, you take the last one from Mr. Nim. Mr. Nim, you can answer. Thank you, Leticia.
Yeah, hello. I just heard what Leticia just gave, which was possibly the same answer I was going to give because, well, I would be going with the time or the duration sort of thing to answer my question. So I'm looking at the shortest possible time now, and then among all these options, I think it's option 2, which says 3 hours post-op. So I was simply going with that one, not even or regardless the other things that follow. I was going for that option straight away. Well, I could go look at the entire answers. I could take them into consideration, but I was going with the rule of duration. I mean, as in which one is shortest with respect to the procedure having been done with. So the shortest one would have been the option 2 I'll go for.
Okay, thank you. So I think that is all. So let us learn something here. Okay. Remember when we're going through the main slides, I was telling you there are things that you should know as soon as you read the sentence, you should predict what is happening. So with respect to option 2, though we know that severe back pain is not expected in someone who underwent coronary artery stent placement, but this person who is now reporting severe back pain, what do you think it could be happening in there? Who can just tell us? That is the kind of excellent student I want us to develop into. When you read it, you should suspect, you should know what to do.
Well, pain in general could be a clot.
Hey, is it a name? You're not raising up your hand.
Oh, sorry.
You're raising your hand, okay?
How do I
So
do
Bright,
that? Sorry. How do I do
your hand
that?
is up. I think when you tap your name, you see something like raise hand also.
Okay. All right. Thank you.
You're welcome. Bright, you can unmute and talk to us.
Hello, please. I think it's there's damage to the aorta, maybe the descending aorta.
Okay, there's a damage. So, which could mean that what is happening?
Bleeding.
Bleeding. So you see how we learn the thing. You see how we learn the thing. That's how you will be the best of all English students. So let's do the rationale. Please, the rationale tells us lots of other things that we are not mentioning here. Use a few seconds to read, and maybe you can grab one thing or two. The rationales we have here, they are in depth, so read it well. There are lots of other things to learn. Can we continue?
No, please.
Yes, please.
Okay.
I think it's fine now, right? I think it's better now. So let us take notes of some one or two things. I've been taking one or two things from there, right?
Yeah.
Now the next one. A nurse in the cardiac intensive care unit assesses a client. So right now it's like you're in the intensive care unit, so you're in the
Hello.
ICU.
Hello.
Someone wants to ask a question. Yeah.
Good evening, Pasha Bakode.
Hey, are you talking to us? Okay, she's gone. Okay. So a nurse in the cardiac intensive care unit assesses a client with diabetes mellitus who underwent a percutaneous coronary intervention with stent placement via left femoral artery 3 hours ago. Which assessment finding requires priority? You see how it has been bolded. Requires priority notification of the healthcare provider. So let us see how we can think through this one too. If you want to try, you show by raising your hand up, okay, in there. Sister Anita, let's go. Sister Anita.
How do I raise my hand?
Okay, Sister Anita is not ready. So
Hello.
you can talk. Zara.
Hello.
Yes, Anita.
Oh,
We can hear you
okay.
now. After
Okay.
Zara, you come in.
Okay.
Hi. I would go for
No, I said let Anita. Oh, okay. Okay, so you continue. You continue. Continue. Don't worry. You go for which one? Zara, you go for which one?
one.
Why? Why would you go for one?
+1 palpable pedal palpable bilaterally. I would assume there's some reduced in pulsation.
Okay.
Ecmosis at the brain.
What's about that one?
Number 2 is expected.
It's expected. Okay.
I feel the wires go through that procedure is done through that area.
Okay.
Rated at 4 in a scale of 0 to 10. That's a moderate to mild pain.
Okay.
Levels of 220, which is 12.5. It's also moderate rate in glucose levels.
Okay, so this one, before you even continue, let me say this. If you want to convert from milligram, I mean with the blood glucose, from milligram per deciliter to millimole per liter, you divide by 18. Okay. When you divide by 18, yeah, 1/8, you will get it in millimole per liter. Okay. And I think you require treatment, though it's according to, I mean, different protocols, but most of the time treatment is initiated when you have a sugar level of 10 and more, okay, or let's say more than 10. Okay, so you are still going for one, right? All right, so thank you. Let's hear from Anita. Yes, Anita, you can unmute and talk to us.
Okay, so I want to try.
Yes, try.
I'm thinking I'll go for number 2.
Okay, so why 2?
I don't know, but maybe a form of bleeding, little bleeding may be expected, but because the groin was used, we expect some form of bleeding, but to get a 2 centimeter ecchymosis, I think it's hello.
2 centimeters is big for you.
Yes, to me, I think it's big. That's why I'm going in for the number 2.
Okay. Let's take the last one. Can I get a male to try? Last person. Hey, today all my guys are missing. Like seriously.
Yeah,
My guys, are you there? Okay, Ellen, you want to talk? Was that Ellen? Hey, Ellen, because I mentioned your name, you've muted. Mokobi, are you there? Or maybe we are tired. Should we close for today? Okay. So
Can I say
Entry.
Sorry, yeah, I forgot to raise my hand again. Sorry.
Oh, no problem.
I'm also going for option 3. I mean, I might be wrong. So I'm looking at the 1 plus palpable pedal pulse bilaterally.
No,
unless I don't understand it. I think that one would be based on the baseline data, as in what the baseline recording was. So supposing the baseline was 80 pulse that they were feeling, plus 1 would be like 81, which is, I mean, I would say a grade 1, a grade A or grade A level of deviation. And then with the 2 option, which also says 2 cm area ecchymosis, left groin. Yeah, that's also something to be expected. So I would also give that as a deviation. But with the option 3 and 4, I'm going for as say about a B to C level of deviation. Where pin is expected, but not maybe 4. Well, I might be wrong. Sorry.
Okay. I think I saw. Thank you very much. I think I saw another hand. Last one. Zara, you want to talk? Okay. Zara, yeah.
Now, I want to emphasize on why I picked on 2. When we are rating,
your voice is very far.
My voice is far. Now you can hear me.
Yeah.
Now, if when we are rating, we are describing the type of pulses. I stayed corrected. We rate our pulses from +3, +4, +3, +2, +1 to 0.
So do you know something? Let me save you that thing. I'll drop something about that when we finish. Hey, who is this? Okay, so I'll drop something about that. When
so the reason why I picked on 1 +1, one thing I know about +1 is a reduced pulses. And then we go to 0.
You see, everything here is not too good. Okay.
Yes,
I
but
mean,
I would be more concerned with pulses since we went through the femoral vein.
okay.
I would be more concerned
Okay.
with the pulses in this area. That's why I selected one. Sorry, I stay
Okay.
corrected though.
All right.
Thank
So
you.
let's look at something. Why do we do this coronary artery intervention? I mean, with the stent placement in the first place. It means we want to what? To ensure adequate blood flow to the heart, right? Normally, people with ischemic heart disease, or let's say coronary artery diseases, they have issues, this kind of issues. So this percutaneous coronary artery intervention is like we just want to open up the blockage so that we can restore blood to the heart. So that is our aim. You know, when blood does not reach the heart's muscles itself, please, we are not talking about internal circulation. You know, the heart also has to get its own blood so that it can stay alive. So through the coronary artery. So that's what we're talking about now. So when there's a blockage somewhere, we want to perform this procedure so that we can open up the blockage to restore blood flow to the heart. You know, before that, patients will be getting chest pain. You should know that and understand that anyone who has a blockage, or let's say an impeded blood flow to the heart muscle, they normally have chest pain. So we do this procedure to open up. The stent is like it's like a wire mesh that we place around where the blockage is, just to open it wide for blood to be able to pass through that joint and extend to the heart muscles. So after this placement, if only it is working effectively, patients should feel no pain. Listen to this well. Patients, if there is an extent of pain, then it means that thing is not functioning well. So you see how tricky the English can be. They didn't give you, if let's say they had given you a pain of, let's say, 8 or 9, you could have chosen this as the answer. But you see, they gave you 4, just to trick you. This one is diminished, though, but you have some blood flow in there. Then, this one is normal. This one has nothing to even do with the stent placement itself. So what do you think? There should be no pain at all. So that makes 3 the answer. So in other ways, we combine content with what? With tracing, answering, and case type question, isn't it? Let us read this small rationality. After this one, we'll take our last one and close the class for today. And maybe come the next time to do a couple of them and we'll end it. Can we move on?
Hello, Seima.
Yes, sister.
Seima.
Yes.
The number 1.
Mm-hmm.
I don't understand why that one is wrong too. I don't understand why that one is wrong. I know +1 pedal pulses means there's no perfusion to the extremity.
Please, there is the minute, not no. Okay. +1 means 1 plus means the minute, not no. Oh. Where is this noise coming from? Who was asking the question?
Me, Cynthia.
This is Cynthia. So plus 1 means there is diminished, not no. Diminished is different from no, like no blood supply. So read the rationale here for option 1 and you will understand better. So you'll be concerned if you don't have blood supply to one part of the leg and there's only one. But if it is diminished, it means there's still some blood supply, just that it's not to its fullest volume. Though it's an issue for
Please, can
concern
I
because
see the
it's not an
question again?
emergency. This is the question. Did you say bilaterally? Plus 1, so 1 plus palpable. So it means there is a palpable pulse, but the volume is 1 plus. Pedal pulses bilaterally. Are you there?
Okay, thank you.
You're welcome.
Sir, can I ask, so does it mean the +1 is not the +1 I was thinking of? I mean, because I took it for the grading thing you gave it as with respect to the level of deviations as in the lab results, you know. So I took +1 to be like maybe a level A form of.
Oh no. So
Okay.
we have. I think so. I'll drop after class. I'll drop something about these pedal pulses. You have to know. Like pedal pulse assessments. Okay.
I
We have.
recently joined, so bear with me, please.
Oh no problem. So we have assessment of pedal pulses and the volumes and what each of them mean. Okay. All right. So let's take the last one and go. Okay.
Hello, Gia.
Yeah.
And so please, the +1, if it was unilaterally, would that have been a priority?
Even if it is 2 plus unilateral, it's a priority. Okay. So wait. The heart itself will still be a priority over that one. Okay.
The angina.
Yeah, it will be a heart because that is the main issue or the main thing why we did the procedure. It's not working. So the heart is prioritized over the leg that will die. Please, you get the difference? Because if we are restoring blood flow through the coronary arteries to the heart, comparing the heart, or let's say heart dead or cardiac cells dead, to your whole leg dead, which one will you prioritize? The organ. So blood flow to the heart will be prioritized over the leg. But this one was just some tricky thing, which was, so you see the rationale added something that you should know. So if in another question, let's say you don't get anything angina or impeded blood flow to the heart, and you get something like unilateral like pulse, then it means that you've learned something from here. It means that after coronary artery stent placement, you should get a bilateral flow or bilateral flow of pulses, not unilateral. So this is an additional information that is telling you. Please you get the word.
The angina was 4 something, so I thought it was a little bit low.
Yes. So you shouldn't feel they will not give you that 8. 8 will be seen even by and let's say a Form 1 nursing student can even see that, and they will not give you that. They'll give you something to put you on the line, something tricky. That's the English for you. Let's take the last one and go. So you have 4 pediatric patients or clients who are brought to the emergency department at the same time. Which one will you see first? This one is easier, right? Who wants to try? Is it tricky?
Can I try?
Yeah, you can try.
I would
After
go
Jifa,
for
you
3.
come.
I'd go for 3.
You go for 3.
Yeah,
What
child
are
with the
3
bruising
indicates?
behind the ear after a football injury. A 3, a bruising behind the discoloration behind the ear due to head injury is associated with rumor. What was it? It has a name. Raccoons, something. So I would associated with a brain
No,
injury.
raccoon is different, please. Raccoon is different.
Raccoon
Yes.
eyes
So Zara, come again. You say something. That's associated with what?
A brain injury. I don't
Brain
remember
injury.
which part.
Okay.
It was an injury to the back of the skull.
Okay, so I mean, you
I don't
played
have the
safe.
right.
You've done
have the
well.
right hand.
Okay.
I would
I
go for 3
understand
though.
you. Okay. Jifa, come in. Mr. Jifa.
Hello. I think I'll choose 1.
You choose 1. Why 1?
For the child is unable to eat and drink.
So you're concerned, right? That the child will go lean. Oh, continue. Don't worry. Continue. Mr. Jifa.
Hello.
Yeah, can hear you now. Oh, I think I mistakenly muted you again. Sorry.
Okay,
You can
hello,
unmute.
sir.
Yeah, I
Sir,
can hear
I'm
you.
also looking at the 3. With the bruising behind the ears after the football. But it's like the bruising. What is bruising? Is it like
Okay.
I'm not getting the word.
Then go
Is
and
it
come
like
again.
blood
Go and find
form?
out
It's
and
like
come. Go and find out and come. Let's take
Okay.
Takujimia. Okay.
Okay.
Taku, your hand is up. Then after Ernestina, then Naomi. Taku, on mute. Takujimia, please on mute. Okay, Ernestina, you can come. Takujimia is not ready. Ernestina.
Okay,
Your hand
I
is up.
think, yeah. Yes. So I would go for number 4 because
Why?
child with increased pain at skeletal pin insertion sites on the leg could be a possible compartment syndrome. So yeah,
Good.
that's what I'm going for.
Good. I like your submission very, 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 very well. Okay. Let's take I think we had so it's Naomi. Let's go.
Oh, I'm here, please.
Please,
Sorry. Okay.
I would go for 1 child who is unable to eat or drink without vomiting, because I think there is something wrong with the esophagus, the alimentary tract. I think there is something wrong there. That is why the child cannot eat or drink, and it should be an emergency.
Wow, you care for your children very, very, very well. I can see that. Then Anita.
Can I speak now, please?
Hello?
Okay. Takuji, after Anita, then you come in. Okay. Sorry.
Okay, all right.
Okay,
Anita.
I'm going, Anita, I'll go for 4. The reason why I'm going for 4 is the word increase. It seems to draw an attention of something that's going on, recurring, and it's not maybe responding to medication or something. And when I look at the other options, unable to drink or eat without vomit, I think that then other measures can be put in place without the person necessarily taking anything by mouth. And with 2, the
you can give
display,
NGT,
yeah, the display, yes, please. The display tympanostomy tube. It said recently, it didn't really mention the time, so maybe it could have been some months and it's falling off.
Okay.
So, and then with the bruising, I'm not going for it because of the bruising, and it's because after a contact sport injury.
Okay, thank you. So the last person, then we call it. So, Takujimia, come with your submission.
Yeah, okay. So I'm going for option 4 because I think this is a possible compartment syndrome. And if an intervention is not taken immediately, the child might lose that limb. So that's why I would go for option 4.
Okay.
Now, looking at option 1, the child is unable to eat or drink without vomiting. Yeah, I'll think of this. Yeah, this is looking at Maslow's hierarchy of needs. This is a physiologic need. That's eating. So, but I think this one can be safely delayed. But this option 4 should not be delayed because that child can lose his limb. And then also, I also know that pain associated with limb should be a priority.
Okay. I like how you are prioritizing your things. Now, let me, I think this one is more of content. Okay. We have something we call basilar skull or basilar skull fracture. Okay. When you have, I think someone is talking, we can hear the person's voice at the background. So we have something we call basilar skull fracture. The base of your skull, you can get fracture over there. Okay. So, initially I heard someone saying raccoon eyes. Raccoon eyes is, look at the name raccoon eyes. Raccoon eyes is when you have a whether a chemosis or a chemosis, however you pronounce that word. Okay, or it's like periorbital bleeding. When you have a chemosis around or a chemosis around the orbital, that is the raccoon eye. It is one sign of basilar skull fracture. And there's another sign we call battle sign. So those of you who are meeting it for the first time today, battle, B-A-T-T-L-E, battle, then you are the sign. That is where you have bruising. Bruising is like a small bleed behind the ear. So today, at least put these two things in mind. Raccoon eyes and battle sign, which is bruising behind the ear. These two cardinal signs can indicate basilar skull or basilar skull fracture. Okay. And remember, no matter whatever thing you are prioritizing here, you remember the brain is first. You remember that slide when we did the brain is prioritized over the leg. And Takujimia, like you rightly said, if the brain is suffering, food can wait. Even with these people, they are even kept MPO. So if the brain is suffering, the brain will not wait for you, but at least food can wait. Okay. So with this little thing said, at least you can bear with me and agree with me that the answer is 3. Though 4 is also not good. It's an emergency, but prioritize the leg over the brain. So that is it. It's more of content. So let's read this. It's interesting, right? Prioritization. Are we all okay now?
Yes, sir.
Okay. So thank you all for coming to class today. We did well, okay? We did well. God